or welcome back to my channel. I am Anushka. I also go by Eternal Honesty on this channel. So today we're just doing a quick little live. This is gonna be a quick little catch-up session and study session. I'm currently in the middle of doing homework. Technically, I already did so I have to do these modules or quizzes, whatever my professor wants to call them, up to a mastery of three. So I have to keep doing quizzes to like hit a mastery of three. And I just started doing them. So I'm reviewing the questions I got correct and the ones I got wrong. I did 10. You can only do 5 or 10 questions each time. I did 10 because I like to do the max to finish quicker. I got 1 out of the 10 wrong. So I'm just going through all of them. I like to read the rationale for all the questions, even the ones I get correct, to understand why I got them correct. So that's what I'm doing now. What's this question? Which measures will the nurse use when speaking to a client with visual deficits? Select all that applies. Okay, face the person when speaking. Use soft indirect lights. Avoid glare by using thin curtains. Avoid use of low tone colors. And I'm like writing down notes for stuff. So technically this is on topics we haven't talked about in class. We'll be talking about these topics next Monday. So I'm just like trying to just get ahead. This assignment is technically due next week, the 15th, or Sunday. No, it's due Sunday. So I'm just like trying to get ahead of my assignments and get it done. So clients with visual deficits. So we're gonna face patient. Three, avoid glares. Hi, hello. Avoid use of. Hi there, hello. Interesting. Hello, hello. So like this apparently is about neurological function and sensation. Oh my gosh, so many people. Hi, hello. Hi guys. Make sure that you guys are liking the live and that you are subscribing. I wish I was a lefty. I wish I was a lefty. Kasai, hold on. I'm sorry. I'm gonna assume that's Hindi, and I don't speak Hindi. Assuming it's Hindi though. But yeah. But yeah. So the topic is neurological function and sensation, which I did neuro obviously for MedSurg and for Pathopharm. I think we did Pathopharm too. So I feel like my neuro is like pretty good. But yeah, I'm like having to do it again. I love when topics just come back up because it makes it easier for you. Because it's like, oh, this is just a repeat of stuff I already know. Like macular degeneration, I know nothing about because we didn't really go over that. And when I was studying for one of my exams, I had to like actually know it. But yeah, preventative. Hello, hello. Hi, Kenneth. Yeah, so make sure you guys are liking the live and you are subscribing to the channel. Eyes from bright lights. Someone's phone is ringing. It's not my phone, clearly, because I'm using my phone. Oh, what is this? There's just like so much going on. I feel so overwhelmed sometimes. Ugh. Okay, we're gonna do the next. Wait, is it two? Why is there two that's due this Sunday? That's rude of them. So I'm gonna do another quiz. We can answer together. Y'all can help me if y'all know anything about nursing. I need more nursing students to come on this live. So if you, yeah, I need more nursing students because I'm a nursing student and I need you guys to help me. But yeah. The nurse is caring for an older adult client who has visual deficits and who wishes to live independently. When planning this client's care, what problem-based care concern will the nurse likely identify? Infection risk, malnutrition risk, home maintenance challenges, or acute pain. So they have visual deficits and they want to be independent. There's nothing about pain in this question because, yeah, there's nothing really about for infection risk, really. Or I would say if they want to live independently and they have visual deficits, it will be like the home maintenance challenges, like, is what I would be concerned about. An older adult client recovering from a cerebral accident resists participating in routine care activity. What is a potential reason for the client behavior? Ooh, this is a good question. Electrolyte imbalances, altered sleep patterns, reduced attention span, or nutritional deficits. They had a CVA, so they had a stroke. Um, I want to say the reduced attention span. Sounds more like it to me. Let's see. Hi, hello. The nurse is care for a client who has a significant motor sensory deficits from a stroke who insist on returning home to live. Oh, this one's easy. Injury risk. Oh. Oh. Hmm. Mm-mm. So we're gonna see how long. I'm trying to study till 9:30, guys. So let's hold me accountable. Let's see if I can stay on till 9:30 to study and get homework done and stuff for tonight. So yeah, just hang out. uh, I'm so confused. A gerontologist nurse is participating. Hi there, hello. So the goal is to study until around 9:30. So I have like over an hour to go, guys. This is reading the medical record film, which finding within this attributes an underlying pathological process. I think this sounds like intraocular hypertension. So this is leaking. Wow. Yes, perfect. So we're at mastery level 2, and I got all these questions correctly. I just need one more jump to mastery level 3. If I get to mastery level 3 on the next one, I'm gonna be so happy because at least one assignment done, and I have another one I need to get to mastery level 3 as well. So let's try that. Like again, goal is to stay and study until 9:30. Let me turn this down a little bit. Go stay on the study till 9:30, guys. Because I need to shower and go to bed, and I want to be in bed asleep by 10 p.m. So let's do another quiz. Let's look at the ones I just did real quick. Let's look at the ones I just did, and then we'll move on. So home maintenance challenge, yes. Experience challenge on home maintenance, like with visual deficits, especially if the client were to live independently, normally, yeah. Okay, great. Reduce attention span, yes. For the client recovering from CVA, it may be extremely difficult for them to understand and wait. Okay. Okay, let's do one more. I'll do one more of 10. Instruction. next question is interesting. Hmm. I guess- What is this question? Oh my gosh. They don't want me to succeed. I'm sorry, but oh, my mom chose to give me an Indian name. Like, and it's technically not. It's not only Indian, it's also Russian, and that's why she gave it to me because she liked the name. I'm supposed to use contrasting color. Thank you. Oh, yes. Oh, yes. I got 10 out of 10. So I'm at level 3 for the first one. So now I need to just move on to the second one. So I got an hour and a half, which shouldn't take me an hour and a half, thank God. Oh, thank God. Yeah, it's beautiful. Mm, okay, perfect. Mm-mm. Okay, okay. Beautiful. Moving on. Next one, next chapter. Perfect. I love that for me. Oh, tomorrow's gonna be a long day too. Okay, let's do this. I wish I could play my own, like, really my own music that I like listening to, because I like to listen to gospel music when I'm studying most of the times, but I would get, like, copyrighted on here if I did that, so I have to play, like, music that won't allow me to get copyrighted. The nurse is conducting an intake assessment of a new older adult client and has asked the client about allergies. The client states, I'm allergic to ibuprofen, so I cannot take that. What should the nurse say next? What happens when you take ibuprofen? That is important for me to know because several different medications include ibuprofen. When was the last time you took ibuprofen? I will be sure to note an allergy to ibuprofen in your chart. Okay, so typically I know when people have allergies, you want to discuss and ask them what happens, right? And that's more of an open-ended question versus the other ones are not. So I'm gonna go with number one. The healthcare provider is prescribing antacid for an older adult. Client, what teaching will the nurse provide about taking this medication? The nurse should immediately assess the current medication therapy with the older adult client. Look at this. was thinking. Okay, if we can flip. An older adult client experiencing high level of anxiety and is prescribed lorazepam, a benzo. Which information will the nurse include in the client teaching? Select all that apply. Do not use alcohol or other central nerve. Yes. If you're taking lorazepam, it is a CNS depressant, so we do not drink or use other CNS depressant with it. Yes, yes, yes. This medication is usually prescribed for short term and does not cure the underlying problem. That is true. Benzos are usually short term, not for long term. Um, try non pharmacological methods to relieve anxiety, I guess. So, high levels of anxiety, I don't think that would really work if they have high levels, though. This medication may increase wakefulness. No, because it's a depressant. Take medications prescribed. Do not skip or double dose. Yeah. Well, typically benzos are prescribed PRN, so I don't even know about that. Let's see. Okay. In order to intense anxiety for several months, and the healthcare providers ensure to basis. The nurse should ensure that the clients receive what. The nurse notes that an older adult client who takes a sedative for sleep is drowsy during afternoon visits in the home. Which assessment should the nurse make? Ooh, this is a good question. Mm-mm. An older adult client Since arthritis pain, which medication should the nurse identify as being the safest for this client? Oh, this is such a trick question. But they're not gonna get me because it's acetaminophen. The others are all NSAIDs. And NSAIDs are not that safe. Nephrotoxic, hepatotoxic. Okay, please. Who said yes? Of course you should say yes. Thank you. Whoever voted yes. I think I'll be done by 9:30. Like, I'm going slow, but we're getting it done. Getting it done, alright? I'm just tired. Like, I'm tired. I'm so tired. Ugh. What were they taking? No, they were taking diuretic. Oh, they're taking a diuretic. Oh, wait. Duh, they're taking a diuretic. They probably want, but they're having an irregular heartbeat. They might have lost too much fluid, so we might want to give them IV fluids. Oh, okay, so I am thinking the right thing. Yes, ma'am. Yes, sir. Whew. Let's see what we got. I'm hoping for at least 8 out of 10. 10 out of 10? Yes, 10 out of 10. I said 8 out of 10. Look at me lowballing myself. Got all of them correct. Beautiful. Let's quickly look what happens when you take ibuprofen, right? Because adverse medication effects are often characterized as drug allergies by client. It is important for the nurse to identify the actual effect of any purported drug allergies. This is not an effort to downplay the client's statement, but to add clarity before documenting it as an allergy. This is more important than determining the time the client last took the drug. It is true that several prescriptions OTC meds contain ibuprofen, but the priority is to better understand the client's report. Which I knew that for sure. And assets avoid taking other meds within 2 hours, yes. Because it can have like interactions. older adults are at high risk for drug interactions. If the client feels sleepy all the time, that might be an indicator of a problem. Medication benefits are a statement of facts. Okay. Yeah, because all the other ones were NSAIDs, right? Yep. Perfect, perfect, perfect. Beautiful. So let's try and do 2 more quizzes. Hopefully 2 more of 10s. I get them all correct and I'm done. It is only 8:17, which is beautiful. Trying to wrap this up. Okay, the nurse is reviewing the medication for the new client together with the client. The client states, I know I should not miss any dose, but sometimes I'm a little bit hit or miss with taking all of them. That sounds like me very non-compliant with my meds. What is the nurse best assessment question? Will he open the question? The nurse. Right. The nurse reviews an older adult client's medication list and immediately assess the client's cognitive function. Which medication caused the nurse to make this clinical determination? I would say the codeine because it can cause that CNS depressant. So you want to check the cognitive codeine. Oh, hi there. Hello, hello. How are you? That's crazy. Did you just vote no? That's crazy. Wait. Codeine. Yes. But I've been pretty good. Just finishing up my last semester of nursing school. Yes, I am pretty much thriving. Very much thriving. Yeah. I'm in my last semester of nursing school. soon to be done. Thank God. Yeah. How are you? Are you still at Success? Please tell me you left that place because. Mm-mm. uh, please give me shows an understanding. No, how is it? How's that going? Okay. What are you doing then? Oh, this definitely has to be it. I'm sure it is. I am sure it is. Like, it's crazy because I be like thinking about them kids sometimes, but I was like, I couldn't do it. Mm. All right, main office. Okay, nice, nice. Is it more? I know, like you had gotten like your degrees. Like, so is it more like management? Like, nurse lens and older client use it as a. Mm-mm, mm-mm. I'm like so exhausted. Oh, I need a sleep. I need coffee. Is what I really need. Mm-mm. Oh, exam 3. Mm, mm-mm, mm-mm. Until line has been prescribed any medication with caution. Should the nurse access us for safe medication? Mm, mm, mm-mm. Oh, there. Fudge. Mm-mm. Would also be that one. Somewhere. Haters gonna hate, I promise you. Oh, what is this? Mm. Perfect. We're at mastery level 2. One more to go. I need to get another 10 out of 10 to hit that, guys. One more. And it's not even 8:30. Calm. I like to review the questions. I like to read all of the questions, usually like briefly like skim through them. Treated to severe non-adherence to the medication regimen. The nurse should not presume the cause of the patient's irregular medication use. Yep, yep, yep. Eat more leafy vegetables. Warfarin is described as a blood thinner, and elevated INR can cause unexplained bleeding. The nurse would recommend the client eat more green leafy vegetables until the INR results return to a therapeutic level. This would help prevent bleeding. Okay. LFTs, liver function tests, because to reduce cholesterol can impair liver function. Yeah, that one I know. Codeine, yes. Often an early symptom of adverse reaction to commonly prescribed medication for older adults, such as codeine. Yeah. Her. Cute, cute, cute. Oh, this is the one I was confused on. Ongoing antacid use and reported indigestion can indicate cardiac problem and cause electrolyte imbalances. Okay. That one I knew. That I also knew. Okay. Last one. And so. Oh, and I also, if I finish this and I have before 9, let's see, I think I have another assignment I can probably do tonight, but I might not because I'll probably just end up getting myself together for bed. Uh, Wait, didn't I do these? Oh no, this is for next week. I'm like so ahead on these assignments. I'm like confusing myself about what day of the week it is. So I'm doing homework that's due for Sunday. Um, yeah, so I'm gonna finish this up, and then I think I might watch One Piece and shower and go to bed. So one more quiz, hopefully one more quiz, and then I can shower, get in bed, watch my show, and then knock out by 10 p.m. That's the goal, is to be asleep by 10 because I gotta be up at 4 a.m. And I chose this, but it is what it is. Tomorrow's going to be this tomorrow will be a good day. I'm going to be in the hospital. I'm going to see some cool stuff. I know Ditch interacts with everything. I would be surprised if it's not digoxin. But let's have a look here. Oh. And it is digoxin. I knew it. Okay. And although John's dementia, experiencing episodes of agitation and wandering, the clients may prescribe risperidone. Why are we prescribing antipsychotic? Right, atypical antipsychotic. The nurse notified the healthcare provider about the prescription based on which reasoning? Mm, yeah, you want to do least to most restrictive, and I also just don't think that's the best thing that we should be doing to older people. Like, uh, mm, get repeat questions to make my life so much easier. I'm pretty sure it'd be calcium. Calcium. The nurse notes that an older client has an abnormal LFT results. Which medication should the nurse question before administering to this client? It has to be the warfarin. The nurse completes an assessment of an older adult. What should the nurse do? Come on now. La la la. To be less effective. Indomethacin, isn't that a prostaglandin, like analog? Which client statement demonstrates safe and effective administration? Beautiful. I got a 9 out of 10 on this one, but I made it to mastery level 3, which is exactly what I needed to be done. Which one did I get wrong? Really? That's interesting. I'm a parenting. Why? Oh, is it because it causes spasm? Oh no, that's to do with the metabolism. Oh, okay, whatever. Okay, that's fine. Yep. So I actually finished before the 9:30, literally about almost an hour before, which is really good. Um, I have one other homework that's also due on Sunday, but that I have to do a bunch of readings and stuff for it first, so that I'm gonna have to wait because I don't even think they posted the lecture slides yet. Let's see. So I just updated my tracker to mark off that I completed that assignment, so I'm happy. One thing off my to-do list. Especially because I do have 2 exams next week, so I'm trying to finish all my homework that's really due next week early on, so I can use the rest of the weekend to study. Let me see. I don't. Is it post? Oh, maybe it's. Oh no, it's just a homework. But yeah, I want to do the readings and stuff first before I do the homework assignment because the homework is based on the reading. So yeah. Anyways, thank you for those who stuck it out with me, and I did complete my homework, what I wanted to get done within the amount of time. So nice. All right, bye. Good night. I'm gonna go shower and watch One Piece.